In a hospital in Ghana, a life-saving operation is underway. Without anaesthesia, emergency operations can't be performed and patients may die. In many undeveloped countries, anaesthesia is often not available. Safe Anaesthesia Worldwide was set up to help address the huge inequalities in healthcare and the lack of anaesthetic provision around the world.
2 litres of
Founder of Safe Anaesthesia Worldwide, Dr. Roger Eltringham, himself an anaesthetist, has helped to develop a machine that can work anywhere in extremely basic conditions. It's called the Gloucester and is made in England.
We really were trying to get a machine together which could work if the oxygen failed or electricity failed or if they both failed at the same time, and that didn't stop working because of expert engineers were unavailable. Most of the machines until now have been designed for different environments to where they're going to end up in. Nobody seems to have thought that these people don't have oxygen and they may not have electricity, and they certainly don't have high-skilled engineers immediately available. The modern machines are so technically complicated that even in our own hospitals in Britain, the hospital engineer can't repair them and maintain them. We have to have specially highly skilled electronics engineers that are they're the only ones who are allowed to touch it. So the possibility of having such people in remote African hospitals is zero.
Around 1 million operations have so far been carried out using this equipment in some of the poorest countries in the world.
In the majority of these countries, anaesthetics is very, very difficult because of the conditions they're working under. It'll work in any condition that we'll find, whether it's an environmental condition or where there are limited supplies or no supplies of compressed gases or electricity. An anaesthetist told me that it's an absolute lifesaver.
Safe Anaesthesia Worldwide provides suitable anaesthetic equipment to help those in need and seeks ways to make anaesthesia more widely available in developing countries. Our equipment costs less than 1/4 of the price of a standard anaesthesia machine used in the West, but it's making a huge difference to the lives of many patients.
This is the main Gloucester vent. There are several models, but this is the basic one, and this is a standard anaesthetic machine which can give any anaesthetic to any patient anywhere in the world. We've reduced it to its absolute simplicity. So basically how it works is that it takes in oxygen, brings it through this vaporizer which picks up the anaesthetic vapor, and then it goes through, this is a mechanical ventilator which ventilates the lungs, and at the bottom shelf is the oxygen concentrator which makes oxygen from atmospheric air. So it doesn't depend on a supply of cylinders, makes its own oxygen there and then. It's very, very simple to operate, and we have to teach people in quite a short time how to operate this safely. And very briefly, down here the oxygen is being made, and it enters the machine here. This turns on the power so that the lungs are then ventilated through these bellows here, and the anaesthetic mixture goes on to the patient, represented by this bag here. So this is the patient's lungs being expanded as the bellows contract. So very, very simple piece of machinery. The beauty of it is that it, if the oxygen fails or the electricity fails, which are very common occurrences in developing countries, the machine continues without interruption. And the anaesthetist doesn't have to do anything. It automatically converts to pressure from the reserve cylinder. So it's easy to function and very safe.
In poor countries, tens of thousands of mothers and babies die each year following complications during childbirth. Many of these lives could be saved by surgery. The equipment we provide is allowing more and more caesarean sections to take place.
I recently come back from Rwanda, and in one of the hospitals there they have 7 of our anaesthetic machines. 2 were in the maternity department. There is an hour counter on the machines, and the machine had done over 9,000 hours over the last few years, and the average caesarean section is going to be considerably less than an hour. So that's 9,000 caesarean sections that are vital to the mother and the babies involved.
And even in harsh environments, war zones or disaster areas, it's still possible to save lives by using simple but effective anaesthetic equipment.
We also have a portable machine, and this is used in situations where there are absolutely no facilities at all. The anaesthetist takes everything with him, and this machine comes in a suitcase which can fit into the overhead locker of a plane. So this machine can be used with absolutely no facilities at all.
Safe Anaesthesia Worldwide also helps to provide training for medical and technical staff in developing countries and gives advice on how to keep the equipment in good working order. Anaesthesia has revolutionised surgery by making it pain-free and safer. We want far more people to have access to it.
I think my aim would be that it was available everywhere it's needed. And I think that's not impossible to achieve. I mean, it's when you think of the projects that are being whistling around, which, to be honest, you have to say, is it value for money? And a lot of them, frankly, aren't. But I think this is definitely value for money. And I think the people that have introduced anaesthesia would be terribly disappointed if they realised that so many still wasn't available to many people. Whereas I think with this particular equipment, we could make it available to everyone.
Our mission is for scenes like this to end. These babies were among 12 delivered overnight at a maternity unit in Sierra Leone. These 5 did not survive. The anaesthesia service was inadequate, and their mothers couldn't have the caesarean sections they urgently needed. They endured the terrible pain of obstructed labour for many hours and afterwards had no baby. For some of them, worse followed. An obstructed labour can cause severe internal damage and fistula formation, which can lead to permanent incontinence. The women's husbands and families don't want them anymore. The women are abandoned and become outcasts. But for some women, there is hope. These ladies are waiting for surgery to repair the fistula and restore them to full health and a normal life, thanks to the availability of anaesthesia. A machine such as the Gloucester can provide the anaesthesia to put an end to the terrible experiences faced by some women in poor countries, and it allows many other emergency operations to take place. But we need your help. Your donation will enable us to work towards a better future where people in developing countries can have the operations they desperately need.